Good morning, good afternoon, good evening, good night, depending on where you are in the world. This is Gloria White, and I'm coming to you from Utah, USA. Today I'm absolutely flabbergasted. I receive emergency alerts from the emergency email and wireless network recall alerts and other helpful and scary information. Today I cannot believe the number of problems. Rubber contamination possible in chicken nuggets. Hand sanitizer recall potential presence of undeclared methanol. Methanol is actually wood alcohol. It's poisonous. And if you get it on your skin and rub it in, it can actually be absorbed into your bloodstream. Nationwide recall of contact lenses. Mislabeled peanut butter ice cream recalled. Salad products recalled. Possible cyclospora contamination. Recall. Allergy alert on pretzels. Seafood recalled. Robitussin recalls cough and cold products. Dressers recalled with a tip over an entrapment hazard. Recall juice drinks. Yeah, you see this blood pressure cuff? I'm feeling like I need one of them right now. Charging cables recalled. Overheating and burn hazards. Fruit cups recalled. Choking hazard. Recall oil. Risk of poisoning. Beef recalled. Possible E. coli contamination. And then there's a health and wellness and prevention section as well. Latin America's COVID-19 deaths seen hitting nearly 390,000 by October. How social distancing affects COVID-19 risk. Hand sanitizers could be toxic, FDA warns. Black Americans hospitalized for COVID-19 at 4 times the rate of whites, Medicare data shows. Okay, now, learn something today about vitamin D. And having low levels of vitamin D was thought to be a contributing factor to the success of people recovering or dying from COVID-19. Well, it's been proven now. It is proven. They have done a study. It is factual that the number of deaths from people with very low or near to none vitamin D levels is astronomical. Those with good vitamin D levels are hardly affected. Okay? So, I'm going to put a link in the description box to a Dr. John, John Campbell, Campbell, who has the lowdown on that information. And now I tried to get the link from the YouTube video from Dr. John Campbell, and it's being limited, Facebook or Twitter. But anyway, I had sent it to someone, so I just copied it from there, and I'll stick it in the description box for you. So it's also saying that people with a lot of melatonin in their skin, the darker their skin, the harder it is for them to absorb vitamin D from the sun, which could be causing the higher number of problems and hospitalizations and even deaths of Black Americans over whites. So it would not only be Black Americans, but it would also be anyone who is dark skinned or dark brown skinned. So it's the vitamin D that is affecting that. and it has to do with the color of your skin. And I'm not being racist. I am the least racist person you would ever want to meet. But I tell you, my parents were awful. I'm sorry to say. But I'm happy to say I didn't grow up like them. In spite of them, I am not prejudiced. And I'm so happy to say that. And I feel so bad for the way that Black Americans have been treated. It's been horrible. Just horrible. Oh, we got to fix it, folks. But Black Lives Matter is not the way that we need to do that, because they are actually backed by the Muslim Brotherhood, and any donations that you make to Black Lives Matter actually goes to Democratic candidates for public office. So you might want to check that before you start donating to that cause to help Black America really, really, really get out from underneath oppression and really, really, really get the same stuff that everybody else in America gets. Like, make the ghettos go away. Make really good schools for all the kids that live in poverty. Truly, we need that to lift people up. And we have to stop looking at the color of someone's skin instead of looking into their eyes and seeing the light that God put there. Anyway, I can't really talk about it anymore because I just get so upset that another human being could be treated that way based on the color of their skin. It's just nauseating to me. So back to more nauseating news. The U.S. FDA revokes emergency use status of drug touted by Trump for COVID-19. Now, my opinion about that is that we have now accepted remdesivir as a proven prophylactic for the treatment of COVID-19 patients, which will now be sold by Gilead starting in September for $320 a vial to Medicare and Medicaid, and $540 a vial to private insurance companies and hospitals. And that typical treatment requires 6.2 vials of remdesivir to treat COVID-19, whereas hydroxychloroquine is very cheap, very, very cheap to make. And anyway, other countries are using it to treat COVID, to actually prevent COVID. So, yeah, it's a whole political, pharmaceutical, I got my hand in your pocket, you got your hand in my pocket, we'll help each other out, kind of thing, which is just disgustingly twisted. Ugh. Yeah. How many of you knew that Dr. Fauci used to be on the pharmaceutical board before he became HHS? How many of you knew that he stole work from another scientist and claimed it as his own? Yeah, real nice guy. Anyway, and he's been very wishy-washy, and in his proclamations about what should be done, what we shouldn't do, other than wash your hands, wash your hands, wash your hands. Don't wear the mask because they don't work. And in the same breath saying that the medical workers needed them. Well, if they don't work, why do the medical workers need them, right? That, wasn't that like the first thought that went through your mind? It was because they didn't have enough masks. then we started making cloth masks. A cloth mask and the blue surgical mask, they only protect the people around you from you. Those masks are only 30% effective in protecting you from other people. So if you really want protection, look for an N95 or an N99 mask to protect yourself. And then it won't matter if they're wearing a mask or they're not wearing one, especially if you're also wearing goggles and taking all kinds of precautions when you go home with anything that you may have on your clothes and so forth and so on. All right, so where were we? Yeah, the status of the hydroxychloroquine. Italy death toll from coronavirus outbreak rises from 44 to 34,345. It doesn't, I mean, from this title, I cannot tell how long it took to do that. China reports 57 new confirmed, 9 symptomatic COVID-19 cases for June 13th. U.S. CDC warns that restrictions may be needed again if COVID-19 cases spike. Well, of course they want it to spike. They want to sell remdesivir. And they also want to push vaccines, which have, some of them have actually killed people. So if you're going to get a vaccine, you better think about it real long and real hard. Okay? Because this is like a flu in the sense that it is mutating. And how many vaccines are there for the flu? And every year they go eeny, meeny, miny, mo. Oh, I think this will be the most this year. And so they make that the flu vaccine that you get. Yeah, it's going to be like that. But trying to rush it through, to hurry it up, to try to get the economy rolling because we think that the vaccine will be the end all, be all. Don't jump on that. Just be cautious. Be cautious. Because once they put it in you, you cannot get it out. So be very careful before you let them put it in you. U.S. CDC warns that restrictions may be needed again. Yeah. Check this out. Warns that restrictions may be needed again if COVID-19 cases spike. Ooh, fears of second U.S. coronavirus wave rise on worrisome spike in cases. Hospitalizations. Where are these people? Don't they read the newspaper? Oh, man, you know what? They need to get away from mainstream media and really find out what's going on, right? They all seem so disconnected. I mean, I'm wondering, is it an intentional thing that they seem like one doesn't know what the other one's doing? They're up there contradicting each other. They can't come up with a game plan. They're not, making people understand the seriousness of this. And even President Trump is not helping. Oh, I'm not going to wear a mask. I can't meet kings and dignitaries and diplomats in a mask. Number one, they're not coming to the U.S. And secondly, how many people in the White House have become infected with all the precautions you guys are supposed to be taking, which are absolutely none from everything I see when I see any kind of news broadcast. You guys are standing close to one another, no mask, somebody with a mask, somebody without a mask, and then you all get up and brush past each other walking out of the room. It's like, are you kidding me? And it makes people, you wonder why people are going, is this real? Is this really real? I mean, look at them. I mean, are they just like, trying to trick us? Yeah, it would make people think that because they're not doing what they're expecting us to do. They're not doing what when we're looking at them. Even when we're looking at them, they're only pretending. So what are they doing when we're not looking at them, when they're not on a TV screen? What are they doing then? Okay. It's one of those days that my brain hasn't let me sleep, so I'm getting a little unruly, if you guys can forgive me. Okay, so coronavirus patients most infectious when they first feel unwell. Well, we already knew that people that were asymptomatic, meaning they had no symptoms, were contagious. Now we know that they're most infectious when they first feel unwell, before they really start getting sick. I'd love to know how they figured that out. U.S. could reach 200,000 coronavirus deaths in September, experts say. Should we believe the experts? Because really, originally it was 2.5 million people that were going to die. I don't know. I mean, we've heard so much false information. How are we ever supposed to know what's real and what isn't real? What is the truth? What isn't the truth? I mean, it's very confusing, and it's adding to the chaos. And I won't go into that now. Okay, I'm just not going to do that to you guys. I'm going to put myself to bed. Sometimes I just have to make myself go lay down and just lay there till I fall asleep, because my brain will not turn off because of my brain injury. It's the most irritating. If you guys want to know anything about it, look up suprachiasmatic nuclei. That's the part of my brain that's damaged. It's like your circadian rhythm that controls when you're awake and when you're asleep. Yeah, that is broken in my brain. Anyway, so I'm going to put the link to this newsletter, and then you can subscribe and you can get that in your inbox. And you can also get like alerts for weather conditions, or say there's some kind of problem. They'll shoot you out an email, and then you'll be on top of things, which is, I think, pretty cool. So anyway, watch out for those rubber chicken nuggets. You know how your kids love those chicken nuggets. Be careful out there, folks. You know I love you. I love you so much. I love you.